So yesterday we looked at the position of Canada within the G7 and international level as well in terms of our AMR leadership. Today we'll focus our time on looking at initiatives that are homegrown, where we take great pride in seeing that we are trying very hard to work together, interconnecting different industries. So today I have the great pleasure to look at, to work with Dr. Herman Barkema and to put a bit of a context. This is the first CAHR health research training platform referred to as CAN-AMR-Net, a new platform to connect AMR training and research in Canada. To set the stage and lead the panel of Hub's leads, I welcome Dr. Barkema to the stage. Dr. Herman Barkema is a professor of epidemiology of infectious diseases at the Faculty of Veterinary Medicine of the University of Calgary with a joint appointment at the Cunning School of Medicine. He is a United Nations University Chair in Infectious Diseases in a Changing Climate. He is a member of the Canada AMR Task Force, the AMR Advisory Group. Dr. Barkema's research program focuses on prevention and control of infectious diseases in livestock and humans, including antimicrobial resistance. Dr. Barkema leads the Antimicrobial Resistance One Health Consortium, the One Health Group at University of Calgary, and the Canadian Antimicrobial Resistance Network. We also welcome the CAN-AMR-Net panelists to the stage.
Yes, come on up. If you could come up and take a seat, that would be great. So our panelists are Mary Wiktorowicz, Natasha, Christie-Holmes, and Dr. Dan Nguyen. Mary Wiktorowicz, Dr. Mary Wiktorowicz, is the professor in the School of Global Health, Associate Director of the Dadali Institute for Global Health Research, and member of the World Health Organization's Collaborating Center on the Global Governance of Antimicrobial Resistance at York University. Dr. Wiktorowicz is the CAN-AMR-Net Ontario Hub Lead. Dr. Natasha Christie-Holmes is the Director of Strategy and Partnerships for the Emerging Pandemic Infectious Consortium, or known as EPIC. Dr. Christie-Holmes works to unite the infectious disease research landscapes across 6 major research institutions and fosters connections with national and international initiatives. She has managed high containment facilities at the University of Toronto for 13 years. She has helped the Public Health Agency of Canada develop biosafety and biosecurity regulations. And during the COVID pandemic, Dr. Christie-Holmes led key research projects on SARS-CoV-2. She is the lead of the translational training career readiness for the CAN-AMR-Net. And Dr. Dan Nguyen is a clinician scientist at the Research Institute of the McGill University Health Center. She's an associate professor in medicine, microbiology, and immunology at McGill University, and a physician in the Division of Respirology at the McGill University Health Center. She is the founding director of the McGill AMR Center, and she is the lead of the McGill CAN-AMR-Net Hub. So with that, I'll give the floor to our panelists.
Good morning. I quickly try to put the coffee in me. I have a jet lag from here to Australia, so it's really necessary. And I did a bit of a tour to China, Pakistan, India, and then ended up in Australia. And you know, I just wanted to tell you what I've seen there in India, Pakistan, and China. We think we have a problem with AMR. Well, go there. Yeah, the resistance levels there are just enormous, and the use of antimicrobials, particularly in animals, is huge, but also in people. So. We should never forget that what we try to do here is very important, but that we also should work in those countries and help them. Yeah, that is essential even for us, because bugs don't stop at borders. Yeah, but if they have high levels, we get them as well. Good. So I'm going to tell you a little bit about the CAN-AMR-Net, the Canadian Antimicrobial Resistance Network, and we'll do that together as a tag team presentation. Mary is not yet here because he thought that we would start at at 9 o'clock, so she may come in a bit later, and otherwise we'll take over her part. So, who are we? So we are a network from with 25 institutions in Canada and also internationally, where we focus on training on AMR. And we do that from a One Health approach. So that means that we don't only focus on humans, but we really also focus on the interaction between humans, animals, and the environment. So we train all the people together, not jack of all trades and master of none, but really to create people, experts in their field, but also that they know that they need to work together. So we have 5 hubs created over the country. That's Atlantic Canada, Quebec, Ontario, the Prairies, and BC. And we'll have local activities in each of those hubs, because we also have existing activities in those hubs that we want to build on. And we'll have people from human health, veterinary, agriculture, biology, social sciences, environmental sciences, and the public and private sectors. So also engineers, lawyers. If you work on AMR, we all like to create innovations, but we also need policy. Yeah? So we need regulations to really make this problem not disappear, but make less. So here are the 5 hubs and the centers that we have there, and you see there's quite a concentration in Ontario and Quebec, but we have them in all the provinces. All 10 provinces have at least one hub, one institution that is part of CAN-AMR-Net. Okay, then I'll now give the floor to Dr. Daunuken from McGill University.
Thank you, Herman. So when this CAN-AMR came about, as Herman just said, the idea was to really bring together a variety of different initiatives across the country. And so I'm at McGill, and I'm going to just share with you what we've done so far, and that we're hoping will be contributing to this network. And so it first started a few years ago at McGill, where with colleagues we created the McGill AMR Center, which was established really with the idea of being able to address AMR challenges and priorities through the lens of collaborations and interdisciplinary research, as well as education, knowledge translation, and innovation. And so I'm just going to give you a whirlwind tour and mention a little bit some of the things that we've thought about, and particularly focusing on some education and how this has led us to mobilize the Quebec ecosystem at large, and now I think hopefully integrating this into a nationwide network. So at McGill, given that we've been at this for about 3 years, we've coalesced a group of nearly 60 different faculty members, and of course with that their teams, their students and researchers, which spans 6 different faculties. So again, not being specifically only focused on human health, the Faculty of Medicine and Health Sciences, but Faculty of Science, Agriculture, Environmental Science, Faculty of Law, different hospitals. And through that, we've focused on 3 different themes, which will not be surprising to any of you working in the AMR space, looking at diagnostics, novel diagnostics and implementation, evolution, surveillance, prevention, and therapeutics. And we've spent a lot of effort trying to build this community through different activities, from seminars, symposia, building partnerships, public and private partnerships within our own institution, and then looking outwards as well. And from the perspective of education and outreach, we've also built on some of the existing resources, such as summer institutes, so building a summer course around AMR, and supporting trainees through studentships and fellowships, doing career development that was specific for AMR, and then also building trainee-led initiatives. Trainees generated content and activities looking towards trainees. And so this is in terms of giving you a few examples of the partnerships that within McGill we have built. So for example, just earlier this year, we hosted the International Environmental Dimensions for AMR. This was in partnership with PHAC. It was an international conference on AMR and in the environment. We've partnered with Entrepreneurial Fund at McGill to support teams that have potentially commercial products. We've worked with our fundraisers and raised awareness and philanthropic support. We've created some translational research platforms. So here, yesterday was co-hosted with the Sepsis Network. So one of the things we focused on are severe infections in the ICU, for example. So this is just a few examples of some of the specific things we've done institutionally. But it was clear that a university doesn't exist in silo, and so about 18 months ago, we started an effort to really mobilize Quebec across the provinces. And this has led to now kind of a very emergent effort. And I say emergent because I think we're still thinking very much about how to implement this. But what we have done through this exercise is to mobilize nearly about 100 different investigators that came from every single university within Quebec. We had expressed interest and engagement from a variety of government and nonprofit organizations, multiple initiatives around infectious diseases and artificial intelligence, about One Health. We created a lot of different partnerships with regional entities, again, public and private. And so in 2024, where we're at is we've mapped out this landscape and we've engaged people. And so we hope to then build on these initiatives for the CAN-AMR-Net. So just a few examples that may be of interest to you. For example, at the University of Laval, they have a very, very large collection of tens of thousands of strains spanning about 4 decades. There are several NSERC training programs that already are ongoing. My colleague had put up there's a pitch for call for students who are interested in One Health and AMR through this OHAP, One Health Against Pathogens. There's a Genome Quebec program that recently launched for projects in the genomics and AMR, and many, many others, which I obviously don't have time to tell you. So this is really just a snapshot of one province and of among others. So with that, I'll pass the baton to the Ontario group. Mary, who's not here yet.
Not here, so I will step in for Mary. Hi, everyone. I'm Natasha Christie-Holmes, as you heard yesterday. I am working alongside Mary to help build out the Ontario Hub. Similar to Dow in Quebec, there's been efforts in the last number of years to cross-connect institutions in Ontario and efforts in Ontario around AMR, and you can see a number of the institutes and partners in CAN-AMR-Net in the Ontario Hub there on this screen. And again, I'll go into some of some details and some of the sort of research strengths that are at the various institutions in Ontario, but what we're presenting today isn't completely inclusive because there's obviously a lot of local activity in the AMR area. So at York, where Mary's based at the Global Strategy Lab, they're working very hard on bridging the gap between science and policy, and they focus on both local, national, and international policy efforts to understand how AMR can be combated with wide-reaching efforts in this area. So lots of policy research, as well as advisory services that they offer to other groups, and capacity building to understand the types of policies and the types of and some of the training offerings are you can see some of the training offerings there in terms of webinars that they have and workshops that they have to have more engagement around policy development in the AMR space. Colleagues at Western, Jennifer Guthrie is one of the named collaborators on the CAN-AMR-Net grant in particular. A number of different research focuses at Western, tackling everything from pathogen genomics and bioinformatics to the molecular understanding of MRSA and Staph aureus. So a wide variety of fundamental insights into AMR, joining the network at Western. At Guelph, at the University of Guelph, Jane Parmley is also leading up another, one of the other awarded health research training platforms that CAN-AMR-Net is working with closely, the Emerging Zoonoses platform. And Jane and her colleagues at the One Health Institute in Guelph have a number of ongoing efforts in research and training with that One Health focus that Herman spoke about. So they are home to the Center for Public Health and Zoonoses. They have the One Health Institute and novel One Health training programs. So again, trying to give a broader perspective to trainees in the area, not creating a jack of all trades, but giving perspectives to the experts in the field about the various other research that's ongoing. And then there's the basic research and innovation, the fundamental research and innovation in various different large-scale projects listed there, as well as work in infection prevention and control, surveillance, and leadership and stewardship. Moving over to McMaster, McMaster has obviously a very large focus on infectious disease with the Global Health Nexus, the Michael G. DeGroot Center for Infectious Disease Research, and the David Bradley Center for Antibiotic Discovery, of course. So a very large cadre of work happening at McMaster, spanning a lot of fundamental discovery, a lot of emphasis on translation of that discovery, and a global leadership story in the area of antimicrobial discovery. At U Ottawa and the Ottawa Hospital, again, many different projects focused on genetic epidemiology, looking at environmental detection, so with that One Health perspective of understanding how AMR is evolving in the environment. They're also the site and involved in many clinical trials that are related to AMR and stewardship, and ISIS-based projects on AMR, looking at surveillance rates and evolution of AMR and the impact of vaccination and other interventional strategies. Here in Toronto, EPIC was established about 2.5 years ago. Again, similar to Dow, we've had a timeline of a couple years to start building a cross-connected network across the University of Toronto, and the 5 major research hospital networks here in Toronto. We are a wider network focused on an ecosystem of multidisciplinary collaborators to focus us all on combating infectious diseases and as well as building rapid pandemic response capacity. But we have a number of training offerings in terms of, our support, our training studentships and postdoctoral fellowship supports. And then, of course, in the last 3 years, we've been extremely excited and proud to partner on this symposium focused on AMR, and now have taken on this national lead in the last, in CAN-AMR-Net. And in the last 2 years, we've funded about 18 AMR-AMS focused projects to support the continuing innovation and research in this area. So across our partners, some of the key research focuses are listed here. UHN, the University of Toronto Sick Kids, Unity Health, Sunnybrook, and Sinai Health are all partners in EPIC, and they all have distinct and overlapping. Obviously, there's a lot of cross-collaboration collaboration within this network and a lot of work together on large-scale projects, especially concerning stewardship and across the different hospital networks and understanding good approaches. And then fundamental research at all of the different institutes here in Toronto. So that's a whirlwind tour through a lot of the local efforts in Ontario on AMR, and under the CAN-AMR-Net umbrella, all of these institutions are excited to work together to develop even more cross-cutting training offerings that will bring all our trainees together, similar to what we saw yesterday at the poster session here. So next I'll hand it back to Herman to talk a little bit, take us a bit farther west.
Thank you, Natasha. So out west in Alberta, we started 6 years ago with the AMR One Health Consortium, where we brought everybody in Alberta together working on One Health. And this has been quite a successful and good journey there. And we brought UFA, UFL, Lethbridge, and UFC together. But not only that, also the research centers of Agriculture and Agri-Food Canada and the colleges, because that's also important. We need those professionals also to learn about AMR and working together and about One Health. So we had quite some funding. That funding is till the end of March for the AMR One Health Consortium, but that will also be part of CAN-AMR-Net. So we had 32 projects, 10 work packages, and we have in total 318 members in Alberta. That shows how many people actually are working in that field. That's only in the province of Alberta, which is less populated than Quebec or particularly Ontario. So, and 11 partnering institutions. So we work together in the whole range of that we need for AMR to really make a dent in the prevalence of AMR. So we worked on discovery of new drugs, like a lot of people do, which is, as we all know, a very difficult one in Canada to do. But also in stewardship with a One Health approach. And we worked with the government of Alberta in creating a stewardship program, which hopefully will be announced soon. So where we had the chief veterinary officer, the chief medical officer, and also environment together creating a program on stewardship in AMR. Of course, diagnostics are quite important, which is the focus, of course, of Biomilieu and others. And and I say that Biomilieu also because it is so important to work together with the industry on these issues. Government and industry are really important if we want to really do something with AMR. Genomics-based programs and development of that. And also we worked a bit, and I say a bit because we don't know yet, on how AMR goes from animals to people. That will be something that I hope that we in the near future will start to understand. Because we don't know how that works. Direct contact at farms, yes, but how does it get to the people in the cities? Is that through water? So we're going to partner. We are a more educational-oriented group. We are going to partner with research groups to find things like that out. Because if you don't know how this transmission occurs, you cannot prevent it. So we had a lot of events in Banff, beautiful site to do it. A lot of publications and of course also citations. So that's for bean counting is always important. So we kept track of that, and then we also created a virtual seminar series, AMR, a One Health approach, with leading experts in the field in Canada and also some outside Canada. And we are going to embrace that one also for CAN-AMR-Net. That will be one of the activities that we're doing together. Had 10 virtual sessions per year. We had 900 participants from 91 countries there. So I think very important that we work together on that. So, and this year, it says actually, it shows nearly that I'm lying, 500 over 60 countries, but that was at the beginning of the seminar series. Good, so then I'll give it to Natasha for Atlantic Canada.
I get to stand in for everybody today. Unfortunately, the hub leads from Atlantic Canada and BC couldn't be with us in person today, but we have been working really closely with Zhenyu Cheng, who's an assistant professor out at Dalhousie. He's created a local network throughout the Maritimes to contribute to CAN-AMR-Net, and he's been working very concertedly on building that same sort of ecosystem out across the Atlantic provinces, joining together with a number of researchers that are focused on AMR from different perspectives, and most importantly, he wanted me to highlight that this year they were able to bring together the Nova Scotia Antimicrobial Resistance Symposium that hosted over 70 researchers in Halifax. That was organized by the Chief Medical Officer of Health and the Chief Veterinary Officer. So again, coming together from a One Health perspective to look at the research and innovation, surveillance, stewardship, and infection prevention and control efforts that are happening throughout the Maritime provinces, focused on AMR. They're also all very strong participants in national networks, including the Canadian Society for Microbiology and of course CAN-AMR-Net, and they're very engaged with the sort of influx of novel pathogens, as they are sort of obviously located on the coast, and they often see different sorts of pathogens circulating on the coast there. And they're involved in large-scale antimicrobial resistance, emergence, transmission, and ecology, ARET program, and you'll see that actually bridges the whole country and has collaborators across CAN-AMR-Net that are part of this ARET program as well. So the Maritimes are coming together with local training offerings and training events to help cross-connect the trainees that are working across the provinces there. And then out in BC, the hub lead is Dr. Amy Lee, who's assistant professor at Simon Fraser University, and again has undertaken a sort of ecosystem development over the last couple years to cross-connect individuals working at the various institutions in BC. And with a really strong connection to the BC Centre for Disease Control, of course, led by a huge amount of work that happens there on AMR. Similar to the Maritimes, they're very cross-connected and involved in national networks. Oh, excuse me, sorry. Including consultation for the National One Health AMR research strategy that we heard about yesterday morning. And they're working very closely with colleagues on the East Coast in the ARET program, looking at where AI and genomics intersect and can inform research and innovation. Similarly, they've started hosting local events to bring trainees and researchers together. This past summer, they had the Western Canada One Health Antimicrobial Stewardship Conference. Again, bringing together people working in various sectors and across disciplines to talk about policy, research, innovation, and infection control, and bringing people in from government, industry, and academic centers. So we're all excited to work together across the country to bridge these hubs into a larger strategic framework for CAN-AMR-Net. And as I mentioned, I think today, this conference this year was a great beginning as we brought trainees through BioMarie support with the travel awards. We had trainees in the room last night at our poster session, bridging from BC all the way to Quebec City. We didn't quite get anybody from the Maritimes, but we're next year for sure. And we're looking forward to building these events that'll span all of our hubs going forward. So I'll pass it back to Herman to talk a little bit more about themes and vision.
Thank you, Natasha. So when we together built CAN-AMR-Net, the ones of you who have experience with writing grants, one of the things that you need to think about is EDI. Yeah? We had no problem whatsoever with EDI because we had at least as many strong women as men. We had a lot of people from all kind of different ethnicities, and we had people from all the regions that were strong that we could involve. So I really like what we have built, and what you build with a grant like that, it's about a topic, but it's particularly about people, working together. And if you see who we have here, I'm really pleased with the people that we have in this grant. 125 people from all over Canada, and the ones that are not a member and are working in AMR yet, they can become a member, and I hope they will. So what we're doing now, and there's Mary coming, please join. So this is, Mary is not late, she is actually on time, but we changed the program, and that's why she is coming like now. So Mary is the lead of Ontario. We already told them about what you're all doing, Mary, so yeah, good. So what we are doing particularly right now is development of our program. That's the first theme. What are the competencies that we would like to see in these graduate students, summer students, postdocs, and early career researchers when they graduate from the program? Because we want you, and I see a lot of young people here, and I hope that you all will become involved in CAN-AMR-Net. We want you to be ready for the next step at the end of the program. That you will be people that are ready to work together, transdisciplinarily, and that you are ready for a career in AMR. And the reality is that will often not be in academia. That will often be in industry or in government or other organizations that work on AMR. So we are with the development of our competencies, we have that in mind as well. So we are, we'll have our seminar series, but we also we'll have monthly webinars, an e-journal club. We will have co-supervision of trainees, and I've done that a lot with people from other areas, and you learn a lot. And me as an epidemiologist, I now know what CD8 does or whatever, although I never will completely understand how that works. But it's really important to also co-supervise students. We will have internships, externships, and we'll also have training workshops on EDI. And we'll be open for other ideas from the trainees and the members on other things that we can do. So knowledge translation is really important. Our trainees, I hope that they will be involved in giving presentations to the public and also to on conferences like this. We will help you with that, train you to do that. But it's really important to learn how to stand in front of a group of patients or farmers and explain it in a language that they will understand. Also, publications for the lay public. And then a fourth theme that is close to all our hearts is indigenous knowledge and engagement. We have a higher prevalence of AMR in our indigenous population. I think it's really shameful what the circumstances sometimes are, how they live, and that we still have a lot of reserves where the water quality is not high enough to drink the water. Yeah, so there's a lot we need to do with indigenous people. We together with them have the responsibility to do something about that. So we will work with indigenous people, and we have indigenous people involved also as PIs in CAN-AMR-Net. We'll work on that. So have community AMR circles, working tables, and it's so important to do that with the indigenous communities, not for the indigenous communities. So the team leads that we have, Simon Otto from UFA, he leads the team 1, where we are creating the competencies for our trainees. So he's a veterinary epidemiologist like me, and he works in the School of Public Health there. Now you see Natasha here sitting on the stage. She leads team 2 for the transdisciplinary training and career readiness. Then we have team 3, Caroline Ritter from UPEI, from the Atlantic Veterinary College. She is an excellent communicator and has brought together a group working on this excellence in knowledge translation and communication. We have 2 co-leads for team 4, Carrie Black and Sean Hillier. Carrie is a civil engineer from UFC, and we have a long history working with indigenous people. And Sean Hillier he's indigenous himself, Mi'kmaq, and he's associate professor at York University, a research chair in indigenous health policy. So our vision is to train the next generation of researchers, practitioners, and leaders in transdisciplinary methodologies and communication skills across these One Health sectors to tackle this very difficult problem, which is AMR. So we'll offer training in One Health AMR research skills in a cross-training environment. Our academia is very siloed. Veterinary students and medical students don't even have one class together. Let's stand alone engineers, pharmacy, even nurses and medical doctors don't have a class together. And that's weird. Yeah? And the same is true for government. The people in the Ministry of Health don't communicate with the Ministry of Agriculture or Environment. We need to bring people together. Yeah? And because the only way that you can create trust is by bringing people together, so that people learn that, oh, actually these medical doctors are actually nice people to work with. Yeah? Yeah, that will be revealing for some of you. But yeah, and that's what I discovered as a veterinarian. I'm also now a prof in human health, and human doctors are, yeah, just veterinarians focusing on one species. Yeah, I mean. So we want to bring these people together. Sorry, Dow. I hope that's not an insult. Good. So now I lost my train of thought here, but my own fault. So also very important is that we work with the government. And if I say government, it's not only the federal government, but also the provincial governments. Yeah, our reality in Canada is that we have an FTP system in our government. So, and that agriculture and health are provincial responsibilities. So we will work with the Public Health Agency of Canada, particularly, on the action plan that is created, and I'm the co-chair of the advisory committee of the Public Health Agency on AMR. But we also will work with all provincial governments on this, because they will really have to work it out and have to work together. So we support the Pan-Canadian Action Plan, but we see it as only the beginning. And then it's not only nationally, but also internationally. And we, fortunately now, WHO, FAO, WA, which used to be OIE, and the UN came together to work on AMR. They only just started. But there's a lot of good activity going. We will work with them also on these issues. So our short-term objectives are, and that comes from the 4 themes that we have. First, we will provide these transdisciplinary competencies. Then we will work with our trainees to help them build these cross-cutting, these cutting-edge technical, professional and leadership skills based on One Health to approach AMR. We will make a pan-Canadian network for mentorship, research and collaboration. And then, last point, promote indigenous knowledge and engagement in efforts to tackle AMR at local, regional and national levels. So we will operate, this is a bit of an organizational structure. So we have a very strong executive committee with the team leads and the hub leads. We have, of course, project manager, admin assistant, and then also in each of the regional hubs, we will have a structure to make all the activities happen there as well. And each of the hubs will learn from each other. So we'll have an indigenous stewardship circle, of course an advisory committee which will be partly international, and then of course we will need to decide, because we have limited money right now. We have 4.4 million in total. We had 2.7 when we started, but there's also matching money already. But we're all going around and trying to round up more funds, because if you have 10 provinces, 125 PIs, and I don't know how many trainees, 4.4 million doesn't go that far. Yeah? So we need to allocate our stipends that we have. So for that we have an adjudication committee. And that's not simple, because we need to look regionally for all the 10 provinces. How are we going to fund these trainees? Long-term objectives, of course, develop a self-sustaining trainee program. And training this high qualified personnel and early career researchers in these fields, equip them with transdisciplinary, cutting-edge technical, professional and leadership skills, and also increase the likelihood that you will get a job that you will like and be successful in. So not included in it is training of practitioners, farmers, other people that work on AMR. So we're going to work with other organizations to see what we can do. We have a very good group of people that can make this happen, but we need to help the medical practitioners, veterinary practitioners, farmers, pharmacists, all the people that prescribe to learn about AMR and make them conscious about it. And part of that is communication skills. How do you communicate as a pediatrician to a father and mother that come with a child with a fever that is most likely is viral and not bacterial, and that the child doesn't need antibiotics, which is a very difficult one. But that's the same with an owner of a dog or of a cat or a dairy farmer. So communication skills are really important in this. Knowledge transfer and exchange to the public will be something that we will do, and we want our trainees to be an important part of that. So when you work with trainees, part of it, what trainees do, are research. So we will connect with the research groups and see how we can connect them with them as CAN-AMR-Net. And you will have noticed that I'm quite passionate about what we need to do internationally. I think with COVID we did it wrong by keeping all the vaccines for ourselves. And where are the mutations occurring? Not in Canada. So only from that perspective we need to work internationally on AMR. So we will reach out internationally and make many international collaborations, which will also be a very fertile ground for exchanges of our students, of our trainees. So important will be that you all become a member of CAN-AMR-Net. Yeah, it's easy to become a member. We won't have immediately funds for you, for stipend, but you will be able to apply for that together with your supervisors. We already have this seminar series. Next year we'll do another round in the fall. The trainees, please participate. And if some of you PIs, experts, would like to give a lecture in it or participate in a lecture, please let us know. We will have another conference, and that will be the first one of CAN-AMR-Net and also the emerging zoonosis together in Calgary, March 11th to 14th. We're creating the program together. Biomilieu is also a partner in this. And I think we're having an excellent program there. Summer institutes like we have in Alberta, like McGill also will be part of the program. We'll have lots of workshops and we're open for all kind of other ideas. So that is what I have about CAN-AMR-Net. I hope that you will be as enthusiastic about it as we are. Yeah? And yeah, we are open for any questions. Thank you.
Thank you to the CAN-AMR-Net leads for sharing with us an inspiring Canadian initiative that has an AMR at the heart of every project and all training efforts. Unfortunately, we do not have time for questions, but I do want to take a moment to thank all of you for the flexibility in adjusting with our schedule changes, but also for the great and hard work you have contributed to this AMR Symposium. Each one of these exceptional leaders on the stage was part of our program planning committees, and this AMR Symposium would not be possible without them. So let's give them a huge round of applause.